Richie Dunham with Vibrancy and the Institute for Strategic Clarity. I'd like to share with you a story of how systems thinking, systems mapping, system dynamics can be useful in trying to understand very complex issues, how we can all come together to understand what we're trying to achieve, what the dynamics are that are creating the problem that we want to address, and how we can intervene in this system to try to address that complexity and achieve the results that we want together. So why this video? We're going to use this opportunity to share that story and to show you some of the dynamics or the mechanics of a system using a story that I was engaged with in the early 90s in Mexico around dengue fever. So I'll use this to show you what causal loops are, what feedback loops are, what intervention points are, and how we used those to tell a story and understand what our strategy is. So dengue started in 1994. I was teaching in Mexico City at the TAM, and a fellow teacher there that was teaching public administration saw some maps, systems maps that we had created, and said, "Hey, could you do this kind of stuff around health?" And I thought, sure, why not? So we met the next day over at the Secretariat of Health, where he was one of the advisors to the Secretary of Health. And they said, this is really interesting. This could be very useful for the work we're doing here. And let's try it out on one of the problems that we're facing right now, which is dengue. Dengue is this particularly complex problem in Mexico, and we know this because there continue to be outbreaks. There's a particular problem that dengue had. It seems like now, today in 2017, might be addressed, but at the time was not. And that was if you'd had one of the previous versions of dengue, serotypes, then such as dengue 1 and 2, which had passed through Mexico. If you have one of the previous versions, when another version, in this case dengue 3, comes in, then your body believes that it's already immune to it, gives it free pass through your body, and it's actually much, much worse. They call this disease bone-breaking fever, so you can imagine it's quite awful. And a lot of people can die from the internal hemorrhaging from this disease. In this case, we knew that there were 14 to 16 million people that had had dengue 1 or 2 in the southern regions of Mexico and the Yucatan, and that there was a 44% probability, according to the statistics, of this serotype or this version coming in and wreaking major havoc on people and killing a lot of people. So 44% of 16 million people is a very dramatic thing. To compound this factor, this is right after the devaluation of the peso, so a secretariat that usually had very little money to deal with large things like cholera and many of these other diseases went from having very little resources to none, and the disease is in, the dengue is in Honduras and coming up through the Americas towards Mexico and could be here in as short as weeks. And so what are we going to do? So they said, could you work on this with us? And I said, sure. And they said, when could you start? And I said, well, I don't know. It's Christmas, so maybe January, February, we could start looking at it. And they said, no, we're like tomorrow. So the day after Christmas, we started. And what I'd like to share with you is what we saw and what we brought together. The model that we were working with was developed by Dr. Jorge Mendez Galvan, a specialist in dengue who'd spent many, many years out in the field and then had done his postdoctoral thesis work at Johns Hopkins. And so there was a book that he had describing intervention policies and possibilities for what to do in Mexico. But it was one of many opinions, and it was a very complex text. So we took that initially and a lot of a review through the literature and what was known within the Secretariat of Dengue, and we mapped that out. So we had a model that had 100 plus variables in it, say a couple hundred variables, and we put that into a simulator. And so if you go to the Institute for Strategic Clarity.org and look up dengue, then you can find a simulator that you can run that we used then and look at how to intervene in the strategy in this epidemic. What we saw was, as we were bringing this to the Secretary, how could we bring this in a high-level synthesized way to tell a story of the core dynamics and see what the intervention policies could be in a graphic, simple graphic way. And this is what I want to share with you that we're using for systems mapping. So what we're going to start with is a sick person. An incubating or sick person comes into Mexico. They're crossing over the border and often undetected. And even if they are detected that they have this, if the person is incubating, then they might just have a fever. And this fever is indistinguishable from others unless you do laboratory work. And they wouldn't tend to do laboratory work. They might not even tend to go to the doctors. But as this sick person or incubating person comes in contact with adult mosquitoes, which are in great volume in this area, then we have an infected mosquito. So as we have more sick people, we have more infected mosquitoes. We have more adult mosquitoes biting these sick people. We have more infected mosquitoes. So what we've already started to do is lay out with these blue arrows, that for convention we'll use blue, is to say that the causality, cause and effect, goes in the same direction. So as there are more adult mosquitoes biting the same number of sick people, then we have more infected mosquitoes. Or we could read that the other way, that more sick people with the same number of mosquitoes, then we have more infected mosquitoes. So it's more and more or less and less. Then as we have this infected mosquito over time, is incubating the disease and becomes contagious. Now as this contagious mosquito, but meets up with a susceptible person, meaning a person who is susceptible to the disease, then we have an incubating person. So again, the blue arrow showing that as there are more contagious mosquitoes biting susceptible people, we have more incubating people. Or as there are more people with these contagious mosquitoes biting them, then we have more incubating people. Over time, these incubating people become sick. They come in touch with these adult mosquitoes, so they're more infected, more contagious, more incubating, and then more sick people. These sick people, over time, become immune. So they process the disease, and if they're fortunate and it's just an awful experience, a bone-breaking fever, then they're immune or they die. So in this case, it's a high probability of that, and that's unacceptable. But as we have more immune people, then we have fewer susceptible people. So this means that we're draining people out of the population. As they become immune, there are fewer and fewer people that are susceptible. So what we see is, and we'll use red as convention, or a negative, is to say that as there are more and more immune, there are fewer and fewer susceptible people. So it goes in the opposite direction. So the blue goes in the same direction of causality. Here it goes in the opposite direction. An increase leads to a decrease, or a decrease leads to an increase. So now as we're working through these dynamics, as we already started to see, as we have more incubating people, more sick people coming in contact with these adult mosquitoes, then we have more and more infected mosquitoes, more and more contagious mosquitoes, more and more incubating or sick, more infected, more contagious, and that continues and continues to grow. A convention that we use is to call that a positive reinforcing loop. And that's also can be thought of as a snowball effect. So this is my attempt this afternoon to draw a snowball flying past that pine tree going down the hill. So that's exponential growth. So more and more leads to more and more. Over here we had the counter effect, that as the more susceptible people become more incubating become more sick become more immune, and then there are fewer susceptible people to be able to become sick. So we call that, for that convention, we call that a negative reinforcing loop, or a balancing. So that's my drawing of a balance. Okay? So this starts to balance out over time, and this is reinforcing. So the problem with the epidemics and what we had discovered continuously happened in Mexico, as a sick person comes in to this high density of adult mosquitoes, then this thing kicks off and it goes very quickly. So we see a very quick rise in the number of people that have the disease or exposed to it. But there is a natural limit that this factor over here will start to limit or balance out how many people are. So it'll run through and it'll stop. So then you see the number of people with it increase rapidly, and then it decreases quite rapidly. The only problem with this disease, as I started out, is this epidemic, is that there's a very high probability, not people just getting sick, but people dying. And so, it's a very nasty hemorrhaging disease. So we don't want that. This is a very bad thing. So the question is then, how can we control this disease so that we don't have, or this epidemic, so that we don't have this problem? So what we want to do is go back in the chain a little bit to understand where are these mosquitoes coming from. Because you remember, this is and what we wanted to show in this very high level depiction of these complex dynamics is an interplay between people and the mosquito population. So understanding a little bit better the mosquito population. The first thing that we see is that these adult mosquitoes lay larvae. So they lay their eggs. And these larvae, in a very short amount of time, become more mosquitoes. They become mosquitoes. And this is a very quick reinforcing loop. So it's positive. More adult mosquitoes lay more eggs become more adult mosquitoes that are laying more eggs that become even more mosquitoes. And this is a positive reinforcing cycle that grows very quickly. So this again is the snowball effect. Now we want to look at where are these larvae coming from. And these mosquitoes are laying their larvae in positive receptacles, they're called. And what that means is that these are receptacles where they can lay their eggs. So as there are more places for them to lay the larvae, then we have more larvae. So what we want to look at is what can we do to stop this dynamic. We have one natural cause, but that's not sufficient because everybody gets sick or exposed to it, and a big percentage of the people die or get very, very sick. To this very quickly growing epidemic that's fueled by this very quickly growing population. So we started to look at what are the interventions that can happen here. And what we knew was mosquito control program, since this is a mosquito-human issue. So the first is that as we see that there are more and more sick people, then we're going to have more and more awareness of the need for these mosquito control programs. So that is one of the key factors is, are there people getting sick? Is there an epidemic or an outbreak happening? Then as we have more and more mosquito control programs, the first thing we can do is fumigate. So that goes after the adult mosquitoes. We can throw larvicides out and we can kill the babies. So what we started to see in this, through the studies of Dr. Jorge Mendez-Galvan, was that while this is a very effective treatment of mosquitoes that are living outside, that they are, by doing the fumigation, that's when the clouds of the chemicals come by, that it's actually not a very effective program because it doesn't attack a lot of the mosquitoes that are inside. And whereas in Texas, where there was an outbreak at the same time, the epidemic didn't run as rampant because everybody had air conditioning inside and the mosquitoes don't do well under cold temperatures. And these houses in this region of Mexico, they don't tend to have air conditioning, they have screen windows, and so the mosquitoes do fine inside. So there's a lot of trash because there's not very strong municipal services where they live. Then because municipal services are weak in those places, then there are more and more trash or receptacles such as tires, pieces of plastic, your water cistern, where they can lay their eggs. And so what he found through the studies was that the fumigation didn't work very well to get all the mosquitoes because there was a lot of these positive receptacles were inside the homes. And when these fumigation, either by plane or by truck came by, people closed their doors. That's what I would do if this gas of chemicals was coming in. I'd shut the doors, but that makes it difficult for the fumigation to get in and kill the mosquitoes. They also looked at the larvicide, the brigades of people that were going around and putting these chemicals in the water. And when he went back to the same places the brigades had been, who were trained and knew what they were doing, he found that they were getting 20 to 25% of the receptacles that he could find. So the problem then becomes that if you don't get all of them, then these larvae, again, within very short time, become adult mosquitoes and they're laying eggs in those places that are positive. So then this continues to happen very quickly. So you get all of them. So while these exist, they weren't very effective. So we went to the secretary with this idea of what we were seeing and said, what should we do? Again, we had the very complex model, and we knew that we didn't have much time to tell this very strategic story, so we used this synthesized map of the core dynamics of people and mosquitoes and the mosquito dynamics to try to tell this story, backed up by a simulator with all the detail in it. What the secretary did as we were finishing telling this story and started to complete it himself said, got it, let me try some of the different strategies that I've been told we need to do with all the opinions I'm getting from all of the different experts in dengue from around the world. A lot of them have to do with very sophisticated things that we can do around creating asexual mosquitoes, mosquitoes that can't propagate, ways of damaging the sac within which she's holding the larva, the eggs for her babies, all kinds of the semen that she's using to fertilize those babies. There are all kinds of sophisticated things it can do, but we don't have any time. It's now, and we don't have any resources. So what can we do? And we said, well, this is a mosquito-transmitted disease. So everybody knows that, and it's coming in. So we do have to kill the mosquitoes. So we are going to fumigate, but we don't have to use the really high-end, expensive technologies that don't get the drops through these screens, because that's not as effective. But we do need to go out and kill the mosquitoes that are outside. We do need to do the brigades and have them focusing on killing the larvae through the larvicides that they're putting out, and we need to do that. He said, but we also need to go in and get people to pick up their trash. So we can use public radio and television to send messages to the communities that you got to get rid of this trash. So more mosquito control programs, lower density at positive receptacles. And we can also use our influence to get the municipalities to come do a one-time pickup of all this trash that we're telling everybody to get. So get rid of all of these tires and the plastic that are out in the neighborhoods, so that there's a one-time pickup. He said, and we also need to tell the doctors that it's coming. Now here, interestingly, as we increase disease detection, telling the doctors it's coming, we're actually better at determining that there are more people involved. So we have a better sense of how many people are getting sick with this. That helps us say that we need even more need for the mosquito control programs. So what that allowed him to do was to say, we're going to do a four-pronged approach. What we're going to do is we're going to go out and we're going to address the adult mosquito through larvicide, or for fumigation. We're going to go out and put brigades out in the fields to put the larvicides in the water receptacles, or places where they can lay the eggs. We're going to do a set of public announcements to clean up the trash, and a one-time pickup to get rid of that trash. And we're going to tell the doctors that it's coming, so that they can do the proper diagnostics, send in the proper information, so that we can know where it is and where is it growing fastest. So here's the use of systems mapping that had a very complex model underlying it, with many opinions on what the core dynamics are, that we were able to synthesize into a core dynamic of the interplay of human beings and mosquitoes and their dynamics, with what are intervention policies that we can do on a four-pronged approach to be able to go for these mosquitoes, the larvae, and the places where they're laying them, letting the doctors know that it's coming, to take care of the people that are normally would be seen as just fever, to check to see if they actually have dengue and help them with the hemorrhaging part. So did this save the epidemic? Well, there wasn't an epidemic, but can we ever know that it was this intervention and these policies that led us to be able to not have that epidemic in Mexico this time? Well, we can't know that. But 10 years later, I was talking with Dr. Jorge Mendez Galvan again, and he said, well, you know what's very interesting? We did not have an epidemic, one. And two, what was very interesting is this was able to help us focus on what we were going to do together and what we were not going to do together. And this was one of the first times that I'd ever experienced that everybody said, got it. There are a lot of other things that we do. All the other parts of this are very important. But today, with the resources that we have, the timing that we have, what we're going to really focus all on is these 4 points of intervention, and not on a lot of other things. So it was very focused effort, very collaborative effort to go out and do this at one time. So here, a very complex issue, given a very specific context of resources and dynamics of what we could do, how we could intervene, and a lot of collaboration in a very short period of time, because of very clear messaging of, given these dynamics, what we want to result from these dynamics, how can we intervene in the system to get to the behavior that we need to get in this very short time with these resources. So I thank you for coming into my home, looking at positive and negative relationships, how those form feedback loops that we can then begin to influence by slowing down the behavior of them, by intervening in specific ways in a multi-pronged approach that we can all agree to. If you want to find out more about what we did in this project, then you can go to the Institute for Strategic Clarity.org website and look up dengue, search for dengue, and you'll find articles that we publish in the System Dynamics Review and the medical journals in Mexico describing this process, the model that we use, and how we used it to inform the policy process for what we did in Mexico in the Secretariat of Health.